Well, hello, everyone. I'm in person. Dr. Audrey DeClue, Dr. Kate Workman is with me.
Hey guys.
Horse First podcast, I decided to, and everybody will answer these questions. Where in the world have I been, right? Did I fall off the face of the earth? I didn't. Obviously, I'm here. I haven't been to space and back. I'm not like the space shuttle that's stuck up there until whenever the others go get them. I was not on that. So I am currently here on Earth. But so I decided it would be better if you hear things from veterinarians as listeners, not just me as one veterinarian doing research. And you guys got to understand that whenever I do these podcasts, it is months of research that I do. Some of these I can just throw together easily, but most of them I actually spend months researching before I even do anything. So I decided I need to speak with other veterinarians, that those of us who are in the sport horse world, and let you know our opinions and what we go through on a daily basis. But this podcast is the KISS theory on lameness, the keep it simple, stupid theory of lameness, because people try to make lameness very, very complicated. And Kate and I have talked about this all the time, is the fact that the reason why we haven't progressed that much in the sport horse world, and why, honestly, I'm so different, why I resonate with listeners, is the fact that I can take very, very complex things, right, Kate? I mean, problems that have been around in the sport horse world for literally centuries, like shivers and string halt, and many other things. And I take a complex thing and I can just make it so simple. And it's scary to people. It is scary, isn't it, Kate? I mean, it's kind of scary.
Yeah, because it's so simple, people have a hard time understanding it, if that makes sense. Or not understanding it, but like trusting it. Because they've always been kind of taught to like veterinary medicine is some extremely difficult, complex thing. And it is in many ways that I think we'll go into today, but it also doesn't have to be, especially when you're talking about communicating with your client, right? So, how you and I will talk about a case would be very different than how I would necessarily to a client or a trainer, or we can talk things very simple, knowing that each other actually thinks about it very complexly.
Mm-hmm.
And I think that's a bit of the difference that confuses people.
I also think, and here's something, you guys, this is part of the veterinary profession, is people rule things out. They just rule it out just because they can't explain it. And there's people like me out there that I'll take the complexity of a problem. And it is, I think, my gift to the world in veterinary medicine is to do that. I worked with people as a lineman that were amazing at like seeing the whole complexity of the electrical system, and then just going, oh, we need to do this. And I'm like 30 steps behind them. But I think I take all those skills and I do that with the veterinary world, is because I am just like a farmer. I open the John Deere manual and I start researching and breaking it down to what the problems are, to where it's so simple that I can explain anything sitting at a bar on a bar stool to anyone. Like I can tell people, what I do for a living, a complex problem with the horse, I can just break it down so simply to them. And they're like, oh, that makes sense. So I think that's the thing, is that's what Kate and I are going to talk about today. But I know that people are wondering, where the heck have I been? And I think I need to
story.
I need to inform you guys. So for the last 2 years, almost 2 years, I was brought in to consult with the U.S. Army at Fort Myers for Arlington National Cemetery with a military case on horses. There's a veterinarian that I will do a podcast with, Dr. Beth Biles. She's the one that brought me in to help her fix this disastrous problem. And I'll wait for the podcast to tell you guys, Beth and I need to tell the story, the truth, like the real truth of the severity of the situation, of the waste of literally millions of US dollars, taxpayer money, mine included, and the complete dysfunction. But as you guys know, as listeners, I will fight, always fight to do the right thing for horses, always. And this was such an injustice to all these horses. I'd never seen anything like it in my whole career as a veterinarian or prior to being a veterinarian. It was I guess the word horrific is the actual word. So anyways, that will be a podcast in itself. And it will be holding the U.S. military, caisson, the old guard at Fort Myers, and other people responsible for the severity of the situation. And you have to also understand, I brought in politics. I brought in people that I knew, many of my clients that know a lot of people, to bring political power and backdoor ways of getting things done. And I'll just tell you, things are getting done, but you also need to know the real story. So that is where I've been. I'm still part of it, but I am on the other end of it where I can help more from the outside. And so I've been extremely busy with that. Kate knows the literal hell I went through with this problem, and so I had to step away, you guys, and it was hard for me to even take care of my clients. But they were, my clients are so loyal, and I so grateful to them because they stayed, they stuck with me, and and understood my fight to save these horses. And literally it was to save these horses. And we'll see what, you guys will get informed with the podcast. So anyways, that's where I've been. So with this new start, I just wanted to do something different. I will continue to do the Horse First podcast with research. I just haven't had the time to jump back in the abyss research because we're doing a lot of other things. So today, Kate and I want to bring a different perspective to you as two veterinarians talking about complexity of lameness, which is, when you break it down, it's very simple. And kind of the norm that's out there, how veterinarians make it so complicated, or they make it so that there's only one thing wrong with your horse. And it really doesn't work like that, does it, Kate? Everything is so connected, and it's not that complex to figure these things out.
Yeah, I think that's part of what helped you come from a different perspective, and where other veterinarians struggle with, or even certain owners, this does not fit within their comfort or wheelhouse, right? That for whatever reason or other. And I think one of them is the notion that you can't image everything. You can't give specific definitive diagnoses. And even if you can, they're one sliver of the real problem. And type A, type of nature people that we as veterinarians are really like a proximal hind suspensory or an injured fetlock. It's one thing, you can wrap your mind around it, you can have a complete diagnosis, you can have all the imaging in the world and give the client an answer. But in all reality, when you come to body lameness and multifactorial chronic lameness, doesn't work that way. It just doesn't, for the same reason it doesn't in people. I mean, human people, chronic pain, they don't even fully understand. And people suffer from nerve pain all the time that they have no ability to image them, even if they could put them in an entire MRI. And we are so limited with horses. So I think that's one of the things that people struggle with is the notion of huge sections become dysfunctional at one time.
Well, and I think it's the education too. And I don't expect academia, the veterinary schools, to teach the complexity of sport horse medicine.
No.
But it's one of those things where, and this is an interesting thing to me, is if there are options to fix these things, right? I always say, just because you're not doing it doesn't mean that it can't happen. Mm-hmm. Just because you didn't come up with something doesn't mean that it doesn't exist. But unfortunately, and you as a listener, you have to understand, in many parts of our academic world and in the general practice or sport horse practice or whatever it is, there is many times a distinct hierarchy. And we need to talk about this because for me and Kate, we only have 3 letters behind our name, and that is DVM, Doctor of Veterinary Medicine. And the people that are in the veterinary schools, they're all board certified or they're interns and residents becoming board certified. And they deserve the respect they get because of the extra years they put in with their education to become board certified. But the thing is that people have to realize too, is that many of us out there are really exceptional veterinarians, and we can solve these problems that they can't. And to only listen, or their response is, well, there's no publications, there's no science papers on this. But we as veterinarians out there working in the trenches, is what I call it, we have the frequency, we have the numbers of results that they'll never see in a university. Because as I've said before in prior podcasts, is nobody brings their top sport horses to the universities for lameness. So for me, it's respecting each other for what you do for a living. I'm very respectful to anyone that I work with. I'm a true team player. I could keep all the money to myself and all the big name clients and everything, couldn't I, Kate? But I'm not like that. I don't inject joints. Like, I won't inject a lower joint because I don't do that. I mean, that's not my lane. And so veterinarians have a hard time playing as a team. And I've grew up since I was little playing teams. Like, here's my basketball reunion, my Lady Braves. This is all my college players. We get together every year, and my coaches. And so and Kate can verify this, I am such a team player. It scares people because I want everybody's opinion. You can disagree with me, right, Kate? I mean, you and I, we disagree all the time, and we're cool with it. But I think it goes back to the same thing, is we all have a place, and we need to respect each other as veterinarians for that place, instead of not wanting to work with other people. And I'm open to working with anyone. You have to earn my respect now, just like I should earn your respect, but I'm going to be very respectful to you, and no matter what, for what you can bring to the team, because we all are not going to agree.
Yeah, and I think I have less problems. Number one, I have less problems in private practice, working with other private practitioners. But further, once I have a mutual relationship, I think that some of the problem is when we get kind of segregated and we're all in our own practices and we're all doing our own thing, we don't come together a lot for various cases. And the ladder of referral is always up, and it's up to people with letters, and the people with letters don't necessarily like consulting with those that don't. And that kind of political class that gets institutionalized is part of it, because I have a lot of veterinarians that are clients, small and large. You do as well. I mean, a high number of veterinarians are my clients.
Me too.
Equine, small animal, mixed animal, etc. And I get along great with them, and I have great referral situations with them, and they come and learn little pieces of information, and I try and help them to go back, because I want them to flourish and I want them to be able to take care of their patients. And I don't want to have to help with things that I think are actually really simple, right? We're not talking about teaching the average veterinarian in a weekend how to treat shivers, but there are pieces of information we can give to help them be successful. And then those veterinarians and I are awesome. They'll call, this is what I'm seeing. Do you think this is a good idea? Should I send them to you? Do you think I should do this? Hey, I just did this. This is now what they look like. What do you think? And owners appreciate that so much. And I think part of why veterinarians don't like to refer is the concern that their client will think less of them, like they don't miraculously have all the answers. And that concern kind of goes away when you send it to a university, I think. Like it's not as intimidating to send it to the university and lose your client, which is kind of interesting, because universities, for me, have by far and large been more difficult to work with from a referral standpoint. But I can call a private practitioner, board certified surgeon, blah, 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 and go, hey, what do you think of this neck? Could we CT it? Do you think it's a surgical? Do you think it's not surgical? And we have back and forth, and they can go, why don't you can inject it. They don't try and then go steal the case and inject the horse on their own. I sent it for CT. Like I didn't send it for anything else. And we can then consult, and I'll send them a follow-up and how the horse is doing, and do they think we should do something else? And those conversations always go very smoothly for me. Like, there's not a, well, you should have done this, or I get to do that, and things like that. I mean, I've had multiple boarded doctors do CTs for me and then go, I think it should have its neck and nerve roots injected. You good doing that? Yeah, of course. Okay, no problem. And then that's done. And that doesn't always happen everywhere. And so I think I interestingly think the average practitioner that's just doing general practice and is seeing equine and is really in the trenches and way too overworked to deal with some of this stuff, they're actually the best ones to collaborate with, in my opinion.
Right. And it's respecting, I think it goes back to the same thing. It's always those of us in private practice, we're very respectful because we know what it's like to be in the trenches. And
absolutely.
we have a timeline that we have to get things done and everything else. But it goes back to the same thing, is there's a purpose for veterinary students to go to veterinary schools to learn their basic education. And just like you and I went through. And I think that when you're looking at complex problems, the universities are not where you're going to figure that out. It's those of us who literally see thousands and thousands and thousands of horses that can break things down, that you can see very quick, well, sometimes quickly, but we all have a rotation of our clients that we see regularly. I mean, that's the difference with the sport horse world, right? Versus, I mean, general practitioners out there, as everyone knows, it's a general practitioner that's ever met me, I give you utmost respect because you have the most difficult job. You have the most difficult job of being a jack of all trades and a master of probably a lot more things than I'll ever be a master of. And you have to take on everything. You take the dirt, you take the grime, you take the grate, and you do something with it. And I don't have the patience for that. I also don't think I'm that smart to be able to know all that stuff, to be honest with you. And so I think is the fact that, and you know this, Kate, I so stay in my lane of what I do. And because I stay in my lane, I collaborate so much with other people to solve problems because I just don't step out of that lane. I'm really good at what I do. I'm really good, but I am never going to step out of that lane and do something I'm uncomfortable with. And that I think that's the biggest thing. You know this about me. I'm never comfortable. Like,
no, you're not. Yeah.
I'm never comfortable with what I know. And I think that's the difference with me, being able to solve complex problems to make them simple so people can understand them, is the fact that I am never comfortable with the answers. I have spreadsheets of patterns. I have numbers to prove those patterns, but I am never, ever comfortable with the knowledge that I have because I'm always asking those questions of why, what, how, when, where, and is this good enough? And trying to make it better. Like you were disappointed in practice, and because you couldn't solve any of these problems. I mean, you could solve some, but not the complex ones.
Because at the end of the day, and I think, again, general practitioners feel this more than anybody else, is that at the time I reached out to you, those patients were my patients. I didn't do general practice. I never have, but they were my sport horse clients. And I was responsible for that horse doing its job, staying sound. And when I couldn't seem to do that, or when I felt like we were dealing with the same issues over and over again, I think that's where the difference is. You have two choices. You can continue to just go down that road and go, well, it's another quarter horse with navicular. Well, it's another proximal hind suspensory. Well, it's another this, that. And you need to get a new horse, or you can really push to be better. And I think that's the difference, right? These are our patients. I am responsible for them to that owner, and I am responsible for getting this horse better. Whereas when you are not responsible to the owner, you are responsible for a colic surgery, or you are responsible for advanced diagnostics or whatever. You don't have the attachment to that horse to dig in and find the answers necessarily, right? That it is very common. I see a horse that went somewhere and was totally worked up, and the bone scan was negative and the x-rays were normal, and they tested it for Lyme and EPM and it was negative. So they have no other answers. So go home for 6 months in a field, or maybe it has EDM. That's another hot topic. And sorry about your luck. That is unacceptable in the sport horse
Mm-hmm.
world. That would never be tolerated. And that's why people end up here, because they're like, oh, they told me to leave them off for 6 months. I had a horse that I saw the other day. We talked about this, that was acutely biting at itself. And they were like, oh, well, don't
Yeah.
know. That's a not acceptable answer for somebody that made a Grand Prix dressage horse and has spent years investing in this horse. That is not okay. And I think that's what happens. And that's what I did. I was not okay not getting better for my clients. And they and the horse are the driving factors for everything.
Yeah.
We have
Well,
an obligation to them.
Well, and I think that is part of it. Is you can be in this for the money, and in the sport horse world, we make good money, but you can be in it for the horse. And I think that's the biggest thing for me is I will always be there for the horse above the people. And it is a differentiating thing for me. I mean, nobody in the world I wouldn't be doing this podcast with you if it wasn't for the Shivers horses. I mean,
For somebody offending you about the Shivers.
yeah, well, that's a story in itself. I haven't told that story, people, of how this all really started. But it was somebody, another veterinarian, got up in my face about Shivers horse that a trainer and I went to see to pre-purchase the trainer to ride and possibly pre-purchase for a client of ours. And this veterinarian, this is when the paper first came out, literally got up in my face. And because I asked her innocently, literally, had you treated the horse for Shivers? At that time, listen, I would be underneath this phone on a rock under the ground, like you could bury it, and I'd be happy there. Right, Kate?
Mm-hmm.
I don't care if anyone knows who I am. I don't care about any of that. So that gal insulted me to my face. She pretty much said that if I was a doctor, after she stated the title of the paper, when it was published, which was December 2015, which the date that this happened was December 22nd, 2015. And that and she literally, the whole title of the paper, she said, and I was like, when she said it, she was like, Purkinje cell blow. I was like, I have no idea what even that is. Like, holy cow. And then she said degenerative. And I was like, okay, I have an idea what that is. And then she said cerebellum. And then she leaned into me very close and said, and if you were a doctor, you would know that if it's in the cerebellum, there is no treatment. And I was so mad. I turned and I about knocked my trainer, the gal the trainer that I worked for. I was like, this is the interaction that started literally all this. And
let's be clear, this is a fascinating part for me, knowing you now for years and truly actually knowing you. You genuinely didn't know that not everybody else was treating Shivers horses.
I had no idea.
You assumed everybody was doing what you were doing.
Absolutely. And I don't I? Many times I assume people are like, I'm so innocent about things. I'm like, I didn't know. And then she gets up in my face like and if you were a doctor, leaning into me, I'm like, you have no idea who I am. You should not get this close to me. Oh. So anyways, that's how this all started. And so I looked up the paper and I was like, oh my God, this is a death sentence to these horses. I called Dr. Kathy Sano. She was out in Washington as an internal medicine doctor. I called her that night when I got done with work. And she said, yeah, we have this in book club. And we all just like, this is crazy. Well, yeah, the crazy became the gold standard.
Yes.
And that's what literally, this is the true story. And I have witnesses that were there with me, including the other trainer who had two other Shivers horses in the in the barn that he could not sell. And he asked me to treat him. And I told him, no, he needs to go talk to his academic vet and have her figure it out. Because what I learned from that day, and I was working in the sport horse world, and it's a very cutthroat world, as Kate can tell you. And it should never be that way, because I'm not like that. I am not a cutthroat veterinarian. And you guys have to realize this as listeners. Many veterinarians, and I know this because I haven't always been a veterinarian. I went to vet school when I was 40. The emotional intelligence of many of the veterinarians is not that great. It's why we have the highest rate of suicide in our profession. And it's very sad, isn't it, Kate? And many people can't handle the stress of the job. They can't handle the politics. They can't handle their ethical and moral boundaries are pushed to do the right thing or do the wrong thing.
In the sport horse world with big money.
Big money. Yep. So, and so people don't make, and plus people may be highly intelligent, but they can't, they're not real stable, ego-wise. They're very weak ego-wise. I was telling Kate this, like, people think I'm some kind of weirdo kind of, right, Kate? I'm like I don't know, what's the word that you use for me? I
don't know. You're Sheldon. That's
yeah.
You're my
calls
Sheldon.
me. I'm kind of out there to a lot of veterinarians because it's intimidating. People always say to me, "Oh, thank you for your passion, Audrey." Like it says you're too much for us when we appreciate your passion, Audrey. I've had so many academic people say that to me. Like, we appreciate your passion. I think all veterinarians should be as passionate as I am about my job and your horses. But the thing I was telling Kate is I'm not the outsider, actually, even though they put me there. I'm actually the person that can sit at a bar, right? I surf, I fish, I'm a blue collar worker. I've done everything, hunt, fish, everything. I love that type of life, and I'm a common person. And I told her, went to dinner one night and we're standing outside the restaurant. We were talking, and there was a 3-phase bank. And I said to her, I don't think I'm the anomaly, because as a lineman, any of us as linemen, we could drive down the road and we could look up at a 3-phase bank, which is 3 transformers tied together. And we could go, oh, that's a 240 bank. Oh, that's a 220 bank or a 308, whatever the voltage is you want. And we knew how to wire that thing. It didn't matter if you're in Alaska or Florida. It didn't matter where you were, even in the world. As a lineman, how things work electricity wise. And so with the profession, someone like me that, or a lineman out there, we all know the stuff, like we know our stuff, but veterinarians, and this is the truth, people, they don't know their stuff.
I think that is not a failure of this single veterinarian. It's a failure of the system, right? So when I tell people or vet students or wannabe vet students that come and hang out here, do you realize in vet school, the amount of knowledge you have to learn is ridiculous, right? And you're learning just massive amounts of everything because they're going to train you to do anything. Yep. You don't learn biomechanics. You don't learn saddle and equipment fit. You don't learn any of those types of things. And when you do learn anatomy, you're a freshman and you learn anatomy of everything. And so you learn everything and never get a chance to come back and go, okay, well, what anatomy really matters and what doesn't, which has really important clinical significance and other stuff that doesn't. You don't have time to go back and learn that stuff. And that's really, for me, where internships should have happened, right? Okay, so you learn all this complicated information and your internship should have been like, okay, you learned this much and I'm going to kind of show you how to direct that in a clinical path. But because interns were treated so horribly for years in the veterinary profession, and they were paid $30,000 a year, and they were the overnight night shift tech, and they treated all the colics, and they did all the stuff that none of the sports medicine practitioners wanted to do anymore, then people stopped doing them. They either stopped doing them and they weren't learning what they should have been doing. Whereas for me, like if somebody came to me and was like, I want to learn, I'm going to graduate vet school, I want to learn from you. Well, then they would spend a long time relearning their anatomy and their neurology and dissecting horses and doing all of those things because that's how I had to relearn. When I first called you, I didn't know any of it. I will never forget listening to Ilya Soa's podcast and being like, that's exactly why my horse is lame. Don't even know that was a muscle. And I
Yeah,
was like a sports medicine practitioner. I traveled the world looking at horses. But it was not what I had learned in my internship. So it never made it into my tool bag. And I had learned about it when I was a freshman and didn't know if it mattered or not.
exactly.
And I think that is a bulk of it. It is not that your veterinarian is incapable, doesn't want to, or can't. Nobody's ever taught it to them.
Exactly. And that's why it's intimidating whenever you have someone like me that brings out all the simplicity of
Right. We were
everything.
standing there looking at that electrical thing. I'm like, I don't know. It's a pole. You and I are so different in that way. I've never done anything other than this, right? I graduated college and I went straight to vet school, and this is all I've done. But we, looked at the car, and I'm like, okay, but if you didn't know how it works, you can't problem solve a problem. A
No,
mechanic knows how it works. They learn it inside and out. And because veterinary school is so difficult and so broad, you can't specialize in horses during vet school. And you really should have done that being crafted and honed as an intern. And unfortunately, that's just not what our industry did. We treated our new grads terrible. And
terrible.
so they revolted and either said, I'm not doing internships. And so they have to learn it on their own, and it takes 10 times as long, and they flounder and it's difficult. Or they went to small animal. They just plumb refuse to be treated like that. And so now we've shot ourselves in the foot. And so
Yeah, there's no equine veterinarians
there's no equine vet.
or people. Yeah,
And your equine vet who does love your horse and wants to do a good job and wants to learn everything is drowning because they're so overworked. And so
yeah.
I think that's where I had a lot of privilege in this situation. You came from it later in different perspective, but I had a lot of benefits to how I'd already established my practice, how I had stepped back and gone, okay, I'm going to step back and relearn this, and I'm going to dissect horses, and I'm going to try and figure this out, where that's not practical to a lot of people.
Right.
For financial reasons, for staffing reasons, for all of those things. And I was privileged enough that I had the support system to allow me to do that.
But Kate, let me interrupt you, and I'm sorry to interrupt you, but I think also it's the fact that you're driven, and my life was extremely busy in the first portion of my career. I mean, extremely busy. There was no downtime. It was go, 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 go. I mean, all the time. And I still took the time. I mean, especially after that veterinarian insulted me. I actually found out who she is. And if I ever, I'll have to call somebody to remember her name, because you know how bad I am about people's names. I can remember all the horses, but I can't remember the people's names. But I would like to thank her, because she made me a better veterinarian. I do. I truly want to thank her, because her insulting me to my face, which is what you never do to an athlete. Like, you just don't do those things to people who are true athletes. Like, we just go, oh man, come on, let's play some ball, right? Let's bring it. But it was a very good thing that happened, because we all don't know our stuff about a lot of things. I don't know stuff about reproduction. You can talk to me about the whatever. I don't even know where the parts of the ovary, or what the uterus does. I mean, I know it gives babies, but all the complexity to it, heck no, right? So that's what I mean.
Right.
But you were driven. You were driven, especially after you met me, because you realized that there was a whole nother level that you had to take it to figure these problems out. And you stepped up to the plate, because what's the point? In my opinion, I am loyal to the horse. And if you look at the owner and you realize that you haven't fixed your patient or even given them an option for the horse to get better, or you're stuck in this, oh, it's a suspensory again. It's a suspensory again. Oh, let's inject the SI again. Let's inject this again. And the horses know better.
I mean, my poor horse was a pincushion.
Oh, he was really lame, by the way, folks. But the difference is it doesn't you made the priority to be better, and you dedicate yourself to do it. And as I told you I'm like, if you want to know how accurate you are with your injections, you have to necropsy. You have to do methyl blue and you have to necropsy them. Because if you do not, if you do not prove me right or wrong, right, and I was right where everything is going, if you don't prove that to yourself and if you don't educate yourself, then you're really never gonna understand that things may be complex. They look like that on the outside, but they are actually very simple when you break it down, because if you do the right thing, the horse gets better. And it takes time many times with the very chronic cases, but on a young 2 and 3 year old quarter horse that, is just sore from performance, having, a little bit of lumbosacral problems and, canters getting a little choppy, easy peasy, right? Easy peasy. And people think you're some kind of genius. And I'm like, no, it's just very simple. It's just
Yeah,
biomechanics.
it is funny, especially, I mean, the really broken horses, I mean, you just start to get an eye for like what is real bad and what is not so bad and what is easy to treat and what's not. But it's funny because people will come and be like, it's so hard for them, and I'm like, oh, this is nothing. And they're like, nothing. I'm like, oh, I don't think I fully believed you. I trusted you because I saw the results and I'm a results person all day long.
Me too.
Period. If it works, I'm game and we can figure out why it works down the road. And it is important to figure out why it works. But once I saw the results, I knew I had to do it. And then it just was a matter of answering. But I think early on, because I would call you and people have to realize this, like it was not easy for a long time. And it was very hard to transition my practice and have horses that I knew I could help now, but I didn't know how yet. And how do you balance being honest with a client of like, I'm kind of practicing this, but I also need you to pay me to do it. And I had great clients who have been with me from the beginning that trusted me and now are really grateful they did on the other side, because those clients I will be loyal to forever. You have those clients as well, that they get my priority because they walked that with me. But I don't think I really believed you when you were like, oh, just wait till you start seeing stuff. Because I thought what I was seeing was bad. You see, like the scale of what I was seeing that was bad, that was unsolved by general sports medicine. I'm like, this is really bad. How bad it gets sometimes is really impressive. And I'll talk to practitioners and they're like, I don't know if I've ever seen a Shivers horse. I'm like, yes, you have.
Yes, you have. They're
Yes,
out
you
there.
have. They're out there everywhere. You just didn't notice the mild or moderate one. You only noticed the severe one. And so when you really see severe, you realize how complex they can spiral out of control.
Well, and I think that's the difference, right? Is solving these problems and understanding that there is an answer for these things, like Shivers and string halt, right? If you understand anatomy, if you understand biomechanics, if you just know your anatomy and neurology, it's very simple. And I taught you that, like, this is, if you understand biomechanics, you can do this. The treatment part takes a little bit, it takes a while, doesn't it, Kate, to feel really comfortable. But once you get it, then you're like, oh, I got this. And then I'm like, okay, you need to just go. You got to do this stuff. But what I find that it's like what I said at the very beginning of the podcast, is the fact that just because you don't rule things out just because you don't have the knowledge for that, right? And that's where a lot of people are stuck. And veterinarians are very, very resistant to change. I think the human species is. I mean, there's very few people like me that just kind of go with the flow. I mean, I would be perfect. As you know, I'd rather be on a fishing boat every day in my sandals and shorts and fishing or surfing, or, I'm just that person, but I'm extremely focused and when I need to be. But people rule this stuff out. And so when you already are ruling things out and you're resistant to change, even though the answers are right there in front of you, then there's no progress. Then I'm such a new paradigm to the profession in all ways, right? Even the way I run my business. I have strict boundaries. I mean, anyone that knows me personally or professionally, I'm very strict, ain't I? I have such strict boundaries about everything because
You have a line in
oh,
your
I do have a line. I have a yellow line in my clinic, people. And it says, if you cross this line, $1,000 will be added to your bill. And then it says,
and you mean it.
not kidding. So not kidding. Like
Yeah.
I truly mean it.
Yeah.
Because I have a job to do, right? Kate and I have a job to do, but and your horse is going to be in the best hands it can be with us or any veterinarian, like we really care.
Mhm.
But it's the fact that the frustration comes out there with our profession, with why there's no veterinarians anymore, is because we haven't solved these problems. And whenever you have someone like me that can solve these problems, the academic world gets scared of someone like me, right?
Yeah, so I'm going to go over. I sent you this podcast a while ago. I re-listened to it this morning and wrote notes because I think it fits perfectly and I bulleted it.
Okay.
So you have 3 different things in terms of teaching and understanding items. You have simplistic methods. So simplistic is fast and shallow. So it's social media plugs, right? That get really viral and really crazy, but there's no depth of knowledge. That happens all the time on social media. We have equine dissections going crazy. We have body workers putting stuff up, and what they say is really cool and interesting to people, and it gets blasted and shared all over, but it's super simple. It's very shallow. It is not results based. It is not based on science, right? It doesn't ask any questions. When you live in a simplistic world, you ask no questions. You just go, okay, it has a castration scar. That's why it can't canter. And that's the end of the discussion, right?
Well, let's just interject here. How many necropsies have I done in my life and you have done thus far?
I did 24 last year.
Right. And
none. But anyway, right? And that is popular thought. That is what gets shared really fast on the media. It doesn't have a lot of actual true knowledge behind it. Number 2, complexity. That thought process is very slow, but it goes very deep. That to me is vet school. It's not so slow, but it's very deep. It asks tons of questions. It's research. It's the hypotheses. It's probing. It is sitting and debating topics. It is going over numbers and criteria and math and all of these things to create it. And then lastly, this is the ticket, is simple, which is not simplistic, but simple is fast, easy to understand, but very depth in its knowledge. It answers all the questions that complexity does, and it is a proven, repeatable, proven thought. That to me is the next step. Simplistic is everybody without an education being really popular on social media, posting whatever nonsense they want, right? It's flagged, and that confuses a bulk of the people. Then there's complexity, which is the vet schools, which is their job. Like, I'm not saying that is a wrong place to be.
No.
You have to learn the complexity of being a doctor. But then that complexity never gets transferred to simple. And that is what you do so well. And I will say this because you'll hate it, and I love you. So the hallmark of a genius in an industry, because you don't think you're a genius, you don't think you're that smart. This is the hallmark. It is not based on intelligence. It's being able to take a complicated problem and making it very simple for people. And that is what our goal is. That is what we were trying to do, because that is the next step that has gotten lost. It lives in either super shallow and very simplistic, or it lives in complexity, and then they actually miss the overarching point because they're worried about a really small tear in a lateral oblique sesamoidean, forgetting that they didn't take a step back and realize the horse is super asymmetrical. They're really painful over their ribs. They can't canter, right? But they get lost in this ultrasound. Whereas what we're trying to do is really simple. It's taking a very complex topic that we know in depth, that is well studied and based in science, and making it simple enough to execute and simple enough to teach. And I think that is the breakthrough that hasn't happened yet, that I know you and I are very trying to do.
Yeah. And as you know, I don't think I'm that smart.
I know, it's so funny.
No, I really do. Listen, people, I worked with brilliant people that were linemen and athletes. I mean, really brilliant people. brilliant. I think I'm just average. I really do. I I just
But it's the ability to take a complex problem and simplify it real simple.
Yeah, I'm good at that. But yeah, I can do that. But I think the majority of blue collar workers can do that.
I agree.
See,
totally. But it's a different skill set.
Right. That it needs to be taught. And I think that's the goal, right? Is I always tell Kate this: a blue collar worker can figure this stuff out.
Yes.
And that's what I am. I spent my whole life being a blue collar worker until I went to veterinary school, and I still consider myself a blue collar worker. I relate to blue collar people every day compared to veterinarians. I have a hard time relating to veterinarians because I don't think like that. So it's an interesting thing. So I don't really think I'm that smart because I've worked with people that are just amazingly brilliant. But the goal that Kate and I, what she's talking about, and thank you for the compliment, but you know how hard I have a hard time.
I know it makes you super weird.
It makes me uncomfortable.
I know.
People, you have to understand, if people come up to me and they like, oh, I heard, listen to your pod. I'm not that, like, right? I'm not comfortable.
Dinner, and this lady comes over and is like, oh, nice your voice. I think it's hysterical because it's so not you. You would genuinely live under a rock and never have anybody. Like, if you could do your podcast with a different audio and a different visual so nobody ever recognized you, I think you would. But
yeah. Yeah, because I'm not that person. I'm not that, but I feel an obligation to the horses, so that, and also that veterinarian getting up in my face, well, that started the whole thing, unfortunately. I mean, I'm grateful to her, actually. Yes. I know, I really am. I'm so grateful to her. But here's the goal, people. In October 18th and 19th, I'm going to start teaching seminars for veterinarians. Kate and I and other veterinarians are going to be there. Board certified veterinarians are going to be teaching. They're here I'm in my office in Florida, in Ocala, Florida. It's going to be in my clinic on my farm. And it's going to be breaking the stuff down and teaching it. The first one is October 18th, 19th. It is girthiness and equipment lameness in equid species. Equid species includes mules, donkeys, everything, right? It's just girthiness and equipment lameness. And then the next one, that seminar will be redone in January, but the next one is going to be on the same weekend. So those of you that are international, you can come in for 4 days and get the girthiness plus the most important one.
Yes.
And I'll be so glad when this stuff is done, because you got to understand, I have tried to give this away to academia. Haven't I, Kate? I literally have begged people to do the research for shivers and string halt horses. Literally. I want this off my plate. I want all of it off my plate so I can go fishing. But the next one is going to be Iliopsoas injuries in sport horses and equid species. And that will include literally Iliopsoas injuries, which there are very few published articles or things written about Iliopsoas injuries in equine athletes. And whereas in dogs, there's thousands. And then from there, it's going to be biomechanics and breaking down how to diagnose based on biomechanics. And I think that's what we're trying to say through this whole podcast is our profession, which I adore, that I want to be like this big team and we can all agree and disagree. But when we're out there on the court, we all play ball together, whether we like each other or not, whether we agree or disagree. The common goal is the horse and to win for the horse and the owner and the trainer. That's the goal. Mm-hmm. So we're going to start teaching these seminars here, and it's very, very small groups. Only 18 veterinarians can come at a time. That's it. So you're going to be I went to, and I have to give a shout out to Kevin Hostler. I went to the cervical symposium that was at Spy Coast. I think it was last month or the month before, in Lexington, Kentucky. And it was great. There was probably 60 some odd people there. And Kevin's out of academia now. He had some board certified people there. It was a good symposium. But the truth is, I didn't come away from that with any practical skills. I came away with some, and give credit to Melissa King, and she knows this. I actually thanked her, because I'm that person, ain't I, Kate? If I learn something from somebody, I always give them credit, and I will always speak highly of them. I'm not like that. I just give credit where credit is due. But what I realize is that things need to be practical and things need to be simple. And I can do that. And Kate can do that. And everybody that has worked with me that has actually understood and do what I trained them to do can do it too. And everybody's at these different levels of education, but that's okay. It's like once you understand things, it's very easy to start extrapolating like, oh, that's what's wrong. Oh, this is what I need to do. It is very, very simple. And so that is our goal. Not only that, but research. And we have a bunch of things coming with research, which is a lot of stuff with Shivers. And that's going to be coming out in the next year. Actually, it's cool. But I'm going to start teaching people how to treat iliopsoas injuries, which also includes treating Shivers and string halt horses. Because I can teach people, I can teach anyone the simple ways of giving these horses relief, because they are all painful. They are all anxious. And the fact that our profession doesn't think that this is a painful thing and that it's a cerebellum thing, going back to the beginning of the podcast, it is why we're doing all of this, right? I've given up my whole life. I would be retired right now. I would be retired if it wasn't for the Shivers.
Yeah, don't think about it.
Oh, I'd be fishing. I'd have a place on St. George's Island. Okay, I'm not going to think about it, but I just did. People have to realize and Kate too. I mean, she's changed her whole life because of me. And this is one thing. Where is that thing I sent to you? Here it is.
Oh no.
Yeah. No, remember I was going through my office when I was bringing my office down. Yeah. So I sent her these really cool drawings and stuff that I did, and I wrote this in May 2016. It's right here. It's on this little sticky note from PPID for Cushing's. I wrote this in May of 2016. And you have to understand, I'm like that. Like this is when I'm like, I do all these, like Kate, I draw everything out. Like,
I know I have some on my arm.
Yeah, exactly. So this is what I wrote, May 2016. Saving just one horse will not change the world, but surely I will change the world for that one horse. And I truly believe that. I believe that one person can make a difference. I think the military with the caisson horses really taught me that literally one person can change a huge problem. And people came to fight. But not only do I change the horse's life, but I change the owner, and I give the owners hope for their horse. But to me, it's all about, I'm not here to change the world. I'm just here to help my profession and help the horses that come into my practice that I and the trainers I work for, and to form a team of veterinarians like Kate and many other veterinarians that work with me, to you as an owner, for your horses to get better. And it doesn't have to be this complex, crazy, complicated thing, right? It can be very, very simple, and we can prevent so many things that are happening to these horses and give people the answers. You might not have the specific answer. I don't care about the nitpicky stuff. I saw a horse yesterday, just segue here real quick. I saw a horse yesterday. It can't canter. Mm-hmm. To me, if a horse can't canter, it's so simple to fix it, right? So simple.
Yes.
And
for those listening, canter problems are one of the easiest things.
Oh my God, right? Like, that's easy. Mm-hmm. And it's not injecting the SI. Like, okay, we don't even go down that topic. Anyways, So this horse was diagnosed with a front end suspensory problem also. And it was 2 months later. I'm like, okay, well, one thing I do know, if it's a true suspensory, you are not back under saddle in 2 months, going to a Congress in 3 weeks. No. So miraculously, the suspensory healed in 2 months. Like, I don't know how that happens, but it goes back to the same thing. People are searching for the answers. And when you see some little thing, you may think that's the problem. But the real problem was the horse couldn't canter. So that I don't know how the right front suspensory, right? It doesn't make sense to me. So for me, if things are illogical, I get this like ding in my brain. Like if things are logical, and you can ask Kate, my brain does not compute illogical. Like it kind of goes on like this, right? I have my Sheldon moments on that, right? My brain just goes into spasm. But if it's logical and I can process it, like I can see it through, like in my brain, I can real quick, then I'm okay with it. But some of the things are, it's another case yesterday was the horse was, I told Kate this, the horse was throwing its neck down. And the solution to this problem was that the hocks were sore. Horses don't throw their heads down when their hocks are sore. That puts more pressure on their hind end, right? It goes back to these simple things of this is complex to most veterinarians. And to me, if you understand biomechanics and how a horse actually works, easy peasy, right? Right? Anytime a horse has hocks are sore, their heads are not down, they're up because they can't push. It's very simple, isn't it, Kate?
And that's what we're going to try and do in some of these talks, right? Is kind of go on cases because we see routine things that I don't know that people think are routine, but we see routine things, but we also see interesting things. And that the conversations we always have is, I can't even believe what I saw yesterday. And we laugh about it and we're like, oh, yeah, that. And, and because it should be that simple. It should not be, we have a horse here. It sat down like a dog. It refused to stop going forward. And the best that it got was it has hock arthritis. And so they treated that for 6 months and it's still no better. Right. So it has to make sense. And this is really where owners can advocate is that, okay, explain to me how that makes sense. Because you actually have the knowledge as an owner, trainer, whatever. You might not have the complex knowledge. You might not understand the ins and outs and how arthritis sets in and what biologics you could use or what, like, you might not know the complexity of it, but a trainer knows when a canter goes bad, right? Like they know that, and you can go, okay, well, when you canter, what do you do? And when you lead change, what do you do? And that can give you this rollout. And they're like, oh, that makes total sense. Like
Easy.
it should make sense. It should not be this nebulous of chronic tests and confusion and where you're like, I guess we're gonna give it osphos and I don't really know what for, and I don't really like it should be able to be explained to you very simply. And if it's not, I would keep questioning. And I think
Yeah.
that's going to be the big piece that we help other veterinarians because you and I would love to have hosts of veterinarians trained in
Mm-hmm.
body lameness. I would
Yeah.
love it. I know you would love it. And I think even though we kind of make things simplistic, it is complicated. And so people have to realize they have to devote the time. It took me years of devoting time to this to really get comfortable with it. And now I'm in the stride of I'm comfortable with it and I enjoy the variations. I enjoy the complexities or the weird outliers or and those I'm starting to piece through because I hope in 20 years I look back and I'm like, oh, that was rudimentary what I was doing. Like I hope that we continue. And so I had to fully understand it before I could be ready to help. I don't think I will ever fully understand it. I don't think you fully understand it, right? The whole goal is that every day you keep learning. But we had to get enough knowledge, enough experience, enough data to start to go, okay, what is safe to teach? What is not safe to teach? Because there is side effects of certain things.
Yeah.
How do you safely teach this to practitioners and how do you get practitioners to understand that you really need to devote some time to this. It is not a come to the seminar and that's all you need to know. You will get hands-on information at the seminar. You will get tools to go home with to help the horse, but that it's a craft that is going to require
Practice.
as much specialization as it did to get board certified. Like this isn't a board certification yet, so I don't have extra initials, but I spend just as much time as a residency in reading papers and studying and practicing and all of those things. And so veterinarians that really want to learn this need to be prepared for that. That if you really want to shift how you look, you kind of have to take a step back and devote the time
Mm-hmm.
to it. You know, you and I both get calls all the time of, can you just tell me what I should do?
No,
Oh, not because I don't want to. It's not because I want the cases. I can't explain this to you over the phone.
no, no, that's where the education comes in, right? Is for me, that's why the Iliasoa's seminar is going to be so important, is because people are going to realize the severity, the situation, like how you need to pay attention. You need to know your stuff. That's why I'm teaching a seminar on it. And you will learn basic things that you can do to help these horses. But it's not going to do what I do to treat a Shiver's horse is going to take months and months of years of practice to get really, really good at it. But you can do some things to really help these horses. And that's my goal, is the more of these horses we help, the more we help the owners, but most importantly, the horses, and the same thing with the first one, girthiness. How many horses out there are girthy? I mean, that's an everyday thing that we see in practice. And the veterinarians are like, don't know what to do. Ulcers. Treat the horse for a month of omeprazole. They scope it again, still has ulcers. They do another month of omeprazole. They scope the horse again, still has ulcers. And the reason why it still has ulcers is because it's painful. And until you take care of that pain, ulcers will never go away. But these are all the teaching things, everyone, that our goal is to help our profession, to work as a team with our profession, and to help more horses. And so Kate and I and other people, we're going to do these type of podcasts so that, we can all know that we're all out there trying to learn, trying to be better, because I'm never comfortable. I'm never comfortable. I always am questioning everything that I do. I mean, Kate can verify that. Kate, thank you so much for being part of this podcast. You guys are going to see more podcasts with Kate and I, because we're going to discuss cases, complicated cases, actually with videos and everything, so you can see the difference before and after. But most importantly, I want to give a huge grateful thanks to all my clients. I've learned so much from all your horses. So thanks for listening. More importantly, thanks to all the horses who have been my greatest teachers. Any feedback, please let me know. Go to declueequine.com. So goodbye, and let's start listening to all the horses so that they have a voice.